Okay, we're gonna be doing a cuboid whip. It's a grade 5 mobilization. It's for cuboid syndrome and midfoot instability. So I have my patient here in the prone position. I'm going to flex her knee to about 70 degrees, and then I'm going to put her in max dorsiflexion. Here I'll hold on to the medial and lateral aspects of her foot and palpate for her cuboid bone just behind the calcaneus. Once I feel like I have a hold of it well, I'm going to put both of my thumbs on it, and then the motion is going to be into plantar flexion and supination as I apply a plantar to dorsal force. So it is a grade 5 mobilization, so there might be a pop or a click, but if not, that's okay too. So here we'll get her stabilized well. Feel for the cuboid, place both thumbs on it, and that's the cuboid whip. So next we're going to do a long bone compression test. This is done to see if they might possibly have a metatarsal fracture. So what I'm gonna do is have my patient in supine, or they can be seated, and then I'm just going to find one of her metatarsals. We're gonna pretend like it's the 5th. So over here on the lateral aspect of her foot, I can feel along here and feel her 5th metatarsal. And then in order to do the special test, I'm gonna place a longitudinal force down the bone here, going this way with my force. And then a positive test would be the reproduction of her symptoms or pain, and also a possible false joint. So now we're doing external rotation of the tibia with movement in a closed chain position. So I have my patient supine. She's also holding onto the table so that she doesn't slide when we do this. She's going to place her feet on a sturdy surface. So I have the wall here, and this is going to help with increasing knee extension. So I'm going to feel the proximal joint line of her tibia here, and then I'm going to place my hands there and have her put her foot on the wall comfortably with knee in slight flexion. I'm going to grab onto her tibia here, pull up the slack, and then as I move into external rotation, extend your knee and press into the wall. Good, and relax. This is the anterior drawer special test. It's an implication as part of the ACL bundle of special tests. So it could imply that she has an anterior medial tear of the ACL or a complete ACL tear. So I have my patient in supine with her knee flexed to 90 and her hip flexed about 45 degrees. I'm going to stabilize her foot with my hip by placing a little pressure on it. And then I'm going to place my hands on the posterior side of her tibia and draw it anteriorly, so towards me. And a positive test with this would be increased anterior tibial translation compared to the other side, or also could be the lack of a firm infeel.